always put in narrative for translation.
Pretty much, yeah.
Yeah, I think we need that for a colloquial instead.
Since the website works.
Okay.
Good evening and welcome to those of you in the room and those of you in the Zoom. It's wonderful to see the ones of you that we can see. Welcome to another edition of Crossroads of Ideas. My name is Laura Heisler. I'm Director of Programming for the Wisconsin Alumni Research Foundation, Director of Outreach for the Morgridge Institute for Research, and a partner with the Wisconsin Institute for Discovery. And these three organizations collaborate to bring you this series each month during the academic year. Before I introduce tonight's moderator, who will get our panel started, I do want to do a couple of things, and I want to start by acknowledging the land that those of us in this room are on. The University of Wisconsin occupies ancestral Ho-Chunk land, a place their nation has called Te-Joke since time immemorial. In an 1832 treaty, the Ho-Chunk were forced to cede this territory. Decades of ethnic cleansing followed when both the federal and state governments repeatedly but unsuccessfully sought to forcibly remove the Ho-Chunk from Wisconsin. This history of colonization informs our shared future of collaboration and innovation. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. And before we turn to tonight's event, I do want to get another date on your calendar. You may, if you came to last month's session, you know that we are featuring a special series within a series this year on the big questions that science and philosophy need each other to address. And that series continues next week, same time, 7 p.m., with a session on what is consciousness. So you might want to mark your calendars to attend that event, and it will similarly be live streamed and recorded. Just a couple housekeeping notes for this evening. We're going to be hearing from a panel, most of whom are in the room, and a special guest who is remote. And we will be fielding your questions in the room as well as online. So if you're in the room and you have a question when we get to the Q&A, we're going to ask you to line up at the microphone that you see in the middle of the room, rather than running a mic to you. And we will alternate fielding questions from the online audience. If you're online and you'd like to ask a question, please use the Q&A function rather than the chat. Use Q&A, and I will be your voice, and we will alternate and try to get to as many of your questions as we can. With that, it is my pleasure to introduce the person who convened this evening's panel and will be your moderator, Kelly Tyrell, Director of Research Communications at UW-Madison. Kelly, it is all yours.
Thank you, Laura, for the warm welcome, and to Crossroads of Ideas for hosting. The talk next week sounds great. I hope all of you tune in for that or come in person. Welcome. It's really nice to actually be physically present in a room with people again, but also to be welcoming an online audience. And I'm especially excited to welcome Caroline Chen from ProPublica and our UW-Madison panelists tonight. Caroline is this fall's University of Wisconsin Science Journalist in Residence. It's a program sponsored by the School of Journalism and Mass Communications and by my office, University Communications, that's been running for 35 years. And yes, that includes through the pandemic. Each semester, we invite a national journalist to campus, now in person or virtually. Thank you, Caroline, for being part of this new era, to visit with classes, to meet with students, staff, and faculty, and to deliver a public talk at the intersection of journalism and science. And that's why we are here tonight. So we're honored to welcome Caroline. She's a health reporter at the investigative newsroom ProPublica. Before she was at ProPublica, she was on the biotech beat at Bloomberg News. She's covered everything from the fall of the blood test maker Theranos to the racial and ethnic disparities that plague cancer clinical trials. Since 2020, Caroline has also been on the coronavirus beat, and she is part of a team covering COVID-19 that was recognized this year as a finalist for the Pulitzer Prize in Public Service. When I asked Caroline what she thought she would want to talk about with us tonight, she didn't hesitate. Data. We've been awash in it. dashboards that update by the day, interactive news sites showing county by county vaccine rates, efficacy rates that slip into our everyday conversation, transmission thresholds, mortality rate, percent positivity. Throughout the COVID-19 pandemic, society has been forced to confront data like never before in the mosh pit of science, whose act is playing out on the main stage in real time. We've been asked day by day to make sense of that data, relying on public health experts and on journalists like Caroline to help us interpret it and make decisions that have sometimes been literally life and death. They've helped us wade through the jumble of information and misinformation that floods our streams. So that's what brings us here this evening. Caroline from her location in Northern California, joining our onstage panel here of UW Madison experts. We're fortunate to have to my left, Dominique Brossard, professor and chair of life sciences communication, and an expert on the communication of science and risk. At the end is Ajay Sethi, an epidemiologist, professor of population health sciences, and the director of the Master of Public Health program in the School of Medicine and Public Health. And then seated in between Dominique and Ajay is Jordan Ellenberg, an award-winning math professor. I know, math awards, what? And author of the best-selling book, How Not to Be Wrong. Fun fact, Caroline once interviewed Jordan for a story while she was a graduate student at the Columbia School of Journalism. He actually returned her call. So we are going to briefly hear from each of our panelists before we turn the floor over to all of you and to our audience online for what I hope is a lively discussion. Laura already explained there's a mic at the front of the room. We're also going to be taking questions from the online audience. So hopefully you're paying attention and have some good questions for our panelists. Without further ado, though, I'm going to pass it to Caroline.
Thank you so much. And I just wanted to quickly say hi to everyone. Thank you for coming. I'm so grateful to UW-Madison for inviting me to be the science journalist in residence this fall, and also to Crossroads of Ideas for hosting our conversation tonight. So as Laura mentioned, we were asked to share a few thoughts, and I thought that I would talk a little bit about how reporters have been challenged in this environment during the pandemic with an unprecedented amount of data, and what I think that we could all be doing better in the media. So first, and Jordan, I do not mean this as a direct reference to your book, but it is not enough to be not wrong. So I'll say that again. It's not enough to be not wrong. What do I mean by that? So I think that journalists do generally worry a lot about accuracy, and it's every journalist's nightmare to have a correction. But I think if your concern is primarily to not have a correction, that's actually not a high enough bar. So for example, if you remember the Provincetown outbreak, there were a lot of headlines that said something like, CDC study shows that 3/4 of people infected in Provincetown COVID outbreak were fully vaccinated. And that might be technically accurate, but I think that reporters need to be thinking about how that headline would be interpreted. So the most likely takeaway from that sort of headline would be that vaccines don't work. And I think that the lack of context there, really lets readers down. Similarly, I'm seeing a lot of headlines right now that say things like 200 employees of X large company have been let go because they refuse to comply with the vaccine mandate. And again, that might be technically not wrong, but I'd argue that it'd be better to give context by using a percentage. And oftentimes when I calculate the percentages, it's like 0.1% or something like that, which I think gives a different impression. Second, I think it's not enough to cite an authority. So what I mean by that is, well, first I want to recognize that journalists are often operating on a lot of deadline pressure. So I used to work at Bloomberg, which is a newswire whose main sell is that it will get you the news faster than anywhere else. So it is extremely hard when you're under that sort of pressure to stop and question a source like the CDC, like the WHO, or your local health department. It is easier to just say, there are X number of cases according to the CDC, because, if the CDC is wrong, that's the CDC's fault, right? But I think during this pandemic, there's just been a lot of shoddy or incomplete data. Not necessarily because anybody's trying to maliciously put out bad information, but because we're in an emergency And science is moving very quickly, and data is sometimes being compiled and published before it's totally complete. So to give an example of this, early on in the pandemic, a lot of outlets were using the WHO's situation reports to calculate a fatality rate, and then just sort of putting that number out there as fact. And this was pretty misguided. First, because early on in a pandemic, that number is going to skew high. But I think there also wasn't any recognition of the fact that the WHO is relying on individual countries to report both their fatalities and infection counts. And then those different countries might be sometimes operating with different definitions for like what counts as an infection, what counts as a case. And so just because this information comes from sort of an authority like the WHO, it really doesn't make that number correct or usable. And I do think it is our job as journalists to really question and examine every piece of information we're given. And the last thought I'll just put out there before to close my part here is that I don't think it's enough to report on what's easily accessible. And what I mean by that is information that is right at our fingertips. So corporate press releases or agency announcements. I think it's fine to report on those, but it's also really important that reporters look for gaps. And one thing I've actually been really proud of my fellow reporters doing is pushing for more specific demographic information on who was getting infected and later on who was receiving the vaccines. So early on, many local health departments said, like, we can't release that kind of data. But after a lot of reporters sort of repeatedly pushed for it, that sort of data was eventually released and helped to highlight some of the biggest disparities in our nations, both in who was being harmed and who had the least access to care. Similarly, a lot of local reporters really pushed their nursing homes to release more information for their readers. And then there were a number of tremendous efforts at a national scale by various newsrooms to compile data and help readers make sense of it. So filling a void. And I think that sometimes being able to point to a gap in the data is as important as reporting on what is available. And I actually think this also applies to who we quote. So sources that are always ready to pick up the phone are fantastic to have, but sometimes I do think it's worth digging deeper to find the best source, not just the most convenient source. So I'll put that out there as some ideas to get the conversation going and turn this over to the other panelists.
Thank you so much, Caroline. I think next we're going to hear from Jordan. He's going to talk to us about our inclination toward and desire for information in the binary, even though that's not necessarily how scientists tend to think and speak.
I'm the source who always picks up the phone. So you got to hear from me a little bit now, but we should hear from other people too. Yeah, I want to just say a word about uncertainty because it's hard to talk about, very hard. Probability is something that maybe one way you can know it's hard is that there was 1,500 years of math at least before there was such a thing as a mathematical theory of probability. It was like that's random, that's chance, that's not something we can study scientifically. It was a long time before math found a way to talk in a probabilistic language, to talk about uncertainty in a quantitative way. And even still, I think as a scientist, and I think my colleagues agree with me, when people ask us to talk about stuff, they don't like it when we say, well, it could be this or it could be that. There's a chance of this, there's a chance of that. They want us as scientists to sort of say how it is. They want us to say, when we talk about binaries, taking off your mask in a public place, they want to know, and people want to know, is it safe or not safe? A new vaccine, does it work or does it not work? Does it prevent getting COVID or getting hospitalized or does it not? Well, already here you have this conflict between two things you might mean by prevent. You might mean make it impossible. That's a yes or no. If you take the vaccine, it can't happen. Or you might mean, which I think is what most scientists customarily mean when we talk about this stuff, make it less likely. Make it a lot less likely or make it a little bit less likely. And the challenge is because everybody's kind of carrying around these two perfectly good English meanings of the word in their minds. When you say, hey, this vaccine definitely does prevent disease, and then you hear that somebody who was vaccinated got it, people get mad, right? People start to doubt your credibility. And I'm going to lead into Dominique with this. I mean, I think that these things are hard to talk about in general, but they're especially hard to talk about when we're talking about safety and risk. There's something in us that really wants that binary yes or no answer. What's safe to do? I think of it like this, like most people are not accountants. So you might say like, Yeah, you're not going to encounter an accountant that often. I looked this up. 99.5% of Americans are not accountants. Now, I can tell you that, but then if you go to a party and you meet an accountant, is your reaction like, what else have they been lying to us about? No, right? Like you accept it, like, okay, most people are not accountants, but I might possibly meet one. And yet I think with things like, people getting seriously ill despite being vaccinated, which for people in our age group is even more rare than being an accountant, I think people really do react with surprise and a kind of change of attitude when they find out something that in some sense was not supposed to happen, or we've said was very unlikely to happen, has happened. So why that is, why we treat certain kinds of things different from others, is a communications question, not a math question. So I'm going to pass it to Dominique to talk about that.
You're very good at transitions, Roger.
Okay.
Thank you so much. Okay, so from the communication side of things, so I'm a communication scientist. Basically, I study how people process information and how they may actually reach certain judgments and make decisions and change their behavior. So let's get back and think about what mathematicians or journalists like to do with numbers. They like to report on them. However, the readers, human beings, don't like numbers. Maybe accountants do. But I would challenge actually the fact that the accountants use numbers to make decisions for everyday activities. They look at the sky to decide if it's going to rain or not. They're not going to go and look at the amount of rain that fell during the night and the potential humidity. Maybe they will do this kind of thing. But most of us, as human beings, we use a part of our brain that's not rational. We use another type of decision-making process that we call heuristic in communication, which is mental shortcuts that will help us make decisions on the fly. And when we look at risky issues and things based on probability, we actually discard that. And going back to what Jordan was telling, we think in terms of, is it safe for me to do that? Not, is it risky for me to do that? So when experts think in terms of probability and tell us there's one chance out of 1,000 or 1 million or 10 million that something bad will happen, we think, am I going to be that one that gets hurt? I don't care whether 9,900, 99,000, whatever else. Am I safe? Is my kid safe? We care about safety. We don't care about risk. So that's really, really critical, because then we think in terms of what will make us perceive something very dangerous. Well, what we call qualitative factors in human communication is that the idea that things that we dread, things that are unknown, things that are uncertain will be perceived as bad. The other side, things that are certain, things that we can, trust and so on, are perceived as less dangerous. So like our mind makes sense of those numbers in conjunction with a lot of elements. And to give you an example, numbers, they don't mean numbers really. They mean something very precise. If I tell you 8 out of 10 people will be getting sick tonight after being here, versus I tell you 80 out of 100, versus I tell you 800 of 1,000, you actually think that 8 out of 10 is more. Because, it's a small number. It looks like 8 people out of 10. That's a lot of people. Well, if I tell you 1 American out of 1,000 dies every day out of COVID, you're like, I don't know what it means. 700,000 people died. 300,000 people died, 500,000 people died. We cannot really make sense of those numbers. If I tell you, here's a Packer game tonight, you go to Lambeau Field, 80,000 spectators tonight. At the end of the day, 80 will be dead. You're like, oh my God. That actually, I can feel that. I know where Lambeau Field is. I know the Packers. I can relate to that. It makes sense. Suddenly, those numbers make sense. So I'm not going to go on and on, but the idea that as human beings, we need to have things we can relate to. We need to make sense of this related to our personal life and so on. Tells you that numbers, they're really not what we take into account when we think about decisions. And I'll leave it to Ajay that's going to tell us how those are treated in the media, hopefully.
Yeah, thank you, Dominique. And yeah, I appreciate being here. And it's nice to see everybody in person and to have an online audience. And, I want to speak a little bit about misinformation, which Caroline already talked about a little bit. But I'll speak to it from the perspective of being an epidemiologist. During the COVID pandemic, a lot of people refer to me as an infectious disease epidemiologist. And I think that's appropriate since we have this major infectious disease that's transmitting. But I personally identify as an epidemiologist who happens to study infectious disease. Because I think of myself as relying on my methodology first, and then applying it to any disease context that may be, worthy of investigation. And right now, certainly a lot of our attention's on COVID. And I want to talk briefly just about sort of when scientists and reporters communicate and talk to each other about topics in which there's a lot of misinformation related to what's sort of being discussed. And you could argue there's lots of topics related to COVID for which misinformation has been circulating. Maybe I can define health misinformation first. And my understanding is that we don't have a really well-defined definition of misinformation. I think that's correct. Thank you, Dominique, for validating me on that. The Surgeon General's advisory on confronting health misinformation, which came out a couple of months ago, defines health misinformation as information that is false, inaccurate, or misleading according to the best available evidence at the time. And I want to put an emphasis on evidence at the time. I think we can all appreciate that science in general evolves, but in the context of a brand new virus and a pandemic, science is evolving very rapidly. In the beginning, hourly, daily, weekly, and I think right now we might be at a stage where we're learning new things kind of on a monthly basis, if I may say that, at least the things that I've been paying attention to. But here I think we can use this idea that science evolves to our advantage. And as Jordan said, we don't always do a great job expressing uncertainty. Maybe we should use that to our advantage. When a single study is published, maybe not even peer reviewed, but out there, and everybody wants to understand how to interpret that data, maybe as scientists, we should say, well, that is the first study. Let's see what other studies say. It's not a bad idea, I think, for us to lean on that important thing. It's hard to do because I think we're human and we want to guide the public in thinking about how to put a study in context, but we have to sometimes resist that urge because a single study is just a single study. I'll say that overwhelmingly, in the many times I was interacting with reporters over the past almost 2 years now, I've really appreciated like how much reporters really did want to get the study right, get the reporting right, so that they could help sort of guide the public navigate the pandemic. And I think scientists too want to do the same, but I think we have to sort of recognize a couple things. One, the medium that's being used, whether it's television or maybe print or digital, has limitations. The length of the story is going to also, prevent us from necessarily going into a lot of depth, and oversimplification can really lead to misleading or potentially inaccurate information. As Caroline said, not providing enough context can sometimes do more harm, and that's unfortunate, but that's the reality of information that's been disseminated. And I think when we think about misinformation, we often think about the 12 scientists or 12 people who are responsible for 90% of the misinformation that's been circulating. I think that got a lot of headlines, but I think it's better for us to maybe not sort of remove the otherness when we think about misinformation. We all do it. We all are part of the machine that tries to communicate the latest science. And very innocently, I might leave out a piece of context during an interview. That's the critical piece of context that everybody should know, but I take it for granted. And so therefore I might be part of that, dissemination of information that's not completely accurate. And reporters are human as well. And I think that's just something we should all recognize. Finally, I just want to say that something I've tried to do, but it's hard, is to try to encourage ourselves and the public to sort of think more like a scientist. I think Jordan described very well how important it is to not succumb to binary thinking. It's very natural for us to do that. We have to kind of avoid that temptation. I'll also say, I try to encourage the public to think of more, do more counterfactual thinking. So in the beginning of the pandemic, I remember, we're stay-at-home orders working. And often what was being reported was, well, if we didn't have stay-at-home orders, our models would show that there would be a lot more deaths than we've actually had. But we don't have the observed data. So we have to somehow imagine what it's like when we don't have a certain mandate or a certain exposure, what life would be like. And that counterfactual thinking is not natural, but it's something we have to do as scientists. And I think it's something we also forget when we're scientists because we're humans first sometimes. a lot of data that's been put out there is based on ecologic research and they have limited value. But again, sometimes they get interpreted or overinterpreted to fit agendas that are trying to be driven. The public should always demand for comparison groups, I think. It's not enough to report a single percentage. It's always important to think about what the appropriate comparison group is. Caroline and Jordan both talked about that. And also, it just came from my epidemiology class that I was teaching just before arriving here. And a basic tenet of epidemiology is before drawing a conclusion, you really need to consider alternative explanations. Could that observation be due to chance? Could it be due to confounding, some other factor driving what you're observing? Or could it be due to some sort of bias? And again, I think as scientists, it's important with reporters to really dissect those limitations that all studies have. And finally, I'm just going to say that I've noticed and I've observed that a lot of times people who are helping the public navigate the pandemic are sometimes contrarian for the sake of being contrarian. That, maybe scientists sometimes just want to be provocative in what they say, but to the detriment of maybe creating more confusion. Maybe they have a book to push or something, or they're trying to get more followers on Twitter. And so if they say something more provocative, they might get more likes or follows. At least that's what I've kind of noticed sometimes. And sometimes, unfortunately, that sometimes can promote mistrust in our institutions. That if you find fault in something, then the public is going to begin to say, well, the CDC maybe didn't do a great job with that. And maybe that's true. But at the same time, we don't want to necessarily promote that erosion of trust that we ought to be having in the institutions helping us navigate the pandemic. And I'll just leave it as that. And thank you. I look forward to the discussion.
Thank you, Ajay. I think it's a good reminder. Scientists are human beings too, and share a lot of the same motivations that non-scientists do. And maybe we can dig into that a little bit more. And I also want to point out, I don't know how you knew this, but before I was here, Jordan, I was meeting with a friend whose husband is an accountant. So I don't know what that means.
It's all lies. It's all lies.
So this is actually where we'd like to invite the audience to start sharing your questions. We want to approach this as a conversation and not continue, sort of lecturing at you with expertise. So just a reminder that there's a microphone in the room for our in-person audience, and there is also the opportunity to ask questions online. And I have some questions too if we get bored. Yeah.
So it seems like a correlate of what you guys are talking about, dichotomizing a choice. People are uncomfortable with complexity. And so because they can't be certain of taking an action. I think going to this question, is it risky, doesn't really tell you exactly what you ought to do. If you say it's safe or not safe,
Right.
then you know what to do. Then people, in the beginning of the pandemic, made decisions about what they were going to do for themselves, their families, their friends. And then the story changed because we knew more. And I think part of the problem was that the experts were undermined because they didn't communicate the idea that what we know now is going to be a lot less than what we know 6 months from now. So then a large majority of the population have this dissonance, this cognitive dissonance between the decision that they made in good faith for their family, friends, and themselves, and then they have to change their mind. People don't like to change their mind. So I guess that's a comment, and the question is, hindsight's 2020, could we have done a better job? And secondly, can we do a better job going forward in correcting the expectation of what science is and numbers are telling us?
I can take that. I mean, we wrote extensively about this, and I think we need also to put that into perspective because a lot of good communication also happened. I mean, so there have been excellent reporters, ProPublica, Stats. It's another, a medium that's done a good job and so on. But I think what you point to is not actually the failure of journalists. and particularly the health journalists, is more the failures of public officials communicated the science a certain way. And you're correct. And we've been again and again, social scientists at the National Academy of Science and so on, such as myself, trying to argue again and again that we need to be careful to present uncertainty when things will change. And I think Ajay said it, like what we know now doesn't represent what we may know tomorrow. The best decision at this point with the best available data is this, which may evolve as we know more. This is a pandemic and so on and so on. But just so you know, like what you point out about the binary choices and how we like certainty and so on, is also true for the journalists in general, journalists. It's like they tend, and again, study after study tells you that they tend to report science as more certain than it is. Because if you have, a byline that's really short and so on, and you need to explain if they're therefore tomorrow, suddenly half of your story is covered by that and not by the juicy study that just come up. So I think it's just a reality we need to work with. And that's why I tell every scientist that's interested in actually doing outreach and so on, they need to understand the psychology of human beings. They will continue to make decisions based on that binary. We can try again and again, and Ajay and I may disagree on this one. We can convince them you need to think about the scientists. Scientists are irrational as much as anybody else. They are human beings. So I think we need to work in our reporting and communication efforts the understanding that people will make decisions based on binaries and so on, and put it into context that science is evolving, it's less than certain and so on. So you're totally right. I mean, and when you say we can do it better tomorrow, it gets more complicated because now we're a global community. Many countries, even if one is trying to do best, even in one scientific discipline is trying to do best, we have suddenly not only public health experts and science communicators and mathematicians that are talking about data. We have anybody and their brother talking about data. Ajay and I have talked about that before, where everybody's an expert suddenly. So it's really hard to contain it and to some extent, control the beast, and that makes it complicated.
Yeah,
Yeah, go ahead, Caroline.
I can offer just a couple of thoughts here. I think first, something I think about a lot is that I don't like to think that I have to simplify anything for my readers. Like, I think that readers are capable of understanding complicated topics and they're capable of understanding uncertainty. And I think when I start with that perspective, then the onus is on me to be a clear communicator. And I think that what I've seen a lot during this pandemic is, Dominique just mentioned, is oftentimes I think officials are worried that people can't handle complexity. So they're going to dumb down the message or leave out the uncertainty. But I think that the public can tell when they're not getting the full picture. And so I err on the side of saying, the problem is you're a bad communicator if you think that people can't handle the uncertainty. The second thing I think about is just there are small things that you can do in your writing. If you're a reporter on deadline and you only have 500 words, I think even saying as of today, those words, as of Wednesday, according to this study, this one study, the study was not yet peer reviewed. Those are small words that already give a bit of an indication to your reader that, this is not a fixed thing. If I'm in a lucky position where I can write long and I can take my time. And so I think what I've tried to do is always tell readers, this is what we know, this is what we don't know, and here's how we're going to get to the answers for the things we don't know. And sort of try to show a little bit of the scientific process as I write. But I do recognize that not everybody in the media has that luxury or space. And so it's an aspiration.
And it's also true, Caroline, that when your work is transmitted, if somebody's going to retweet a quote in 140 characters, what's going to get lost? As of Wednesday, right? As of Wednesday is gone.
Yeah.
And the rest of it is there. So the reality of how that material that you write is shared is going to lose some of that stuff. I mean, can I say one thing to your point? Because I think you brought up something really important, talking about decisions. It is easy for me, and sometimes I have the luxury of being a powerless mathematician. And I can write an article being well, it's not this or that. Should you eat in a restaurant? I'm well, maybe you could just eat in a restaurant less than you otherwise would. If it's super inconvenient not to do it, then do it, but try to reduce how much you do it, whatever. the mayor doesn't have that luxury, right? The county, when they're deciding, they have to decide, is there going to be a mandate or is there not? They have, my mom worked for the FDA for many years. At the FDA, they don't have the luxury of saying what I say. Like, yeah, like it seems like sort of safe, like think about it, do or don't. They have to just make a yes or no decision. So binary decisions are real. I feel like the way I said it, I made it sound like, oh, these chumps who are always talking about binaries. Like, no, if you're a public official, often you have to deal with binaries. You have no choice because that's how policy is made. So I respect that's actually a very difficult a position to be in that we often don't face.
Yeah.
It's a luxury that we can be uncertain about stuff.
Yeah, which I've actually found really interesting because we tend to, especially when we're talking about our institutions, the CDC tells us something or Public Health Madison-Dane County tells us something or the FDA tells us something. And there's always so much nuance in there. Working as I do for the institution, I've managed a lot of the frequently asked questions for our campus websites. And it's usually my job to try and help make sense of that. And I'm usually pouring through pages and pages of CDC documents or state Department of Public Health or Health Services documents. And it's complicated and it does take people making decisions about how much is too much and how much is the right amount. I don't know if we have any audience questions from online, but I did want to ask Caroline, as a journalist, and this is really queuing off of, I think, what we just talked about and what Ajay ended on. You play a role in deciding who gets to be an expert, right? In who you quote in your stories. So how do you make those decisions? And can you speak to how other reporters or media outlets might make those decisions and really, decide who deserves a platform? And I think when we tend to talk about media, we forget that there are so many different types of media, and a lot of us tend to think of television or the punditry. So as a journalist, how are you making those decisions? Who gets to be an expert?
That's a great question. I think that I'm lucky because I've covered healthcare for 8+ years at this point. And so I have a pretty wide range of sources that I've gathered over time. And I think there are a couple of things I think about. I mean, obviously the question of who is the best person, but then also like, what is the representation that, across the sources, who are you going to be hearing from? Like, I care a lot about there being a diversity of voices and that I don't just reuse the same person over and over again. So part of my practice has been, things have calmed down a lot now, but, in early 2020, when everything was extremely hectic, is I would I have a spreadsheet of sources that I was making for our newsroom, and I would add people to it on the weekends so that when we were on deadline, we'd already have those people ready to go. And I think that is a conscious practice that one has to opt to do. I think there are a lot of reporters who are local newspaper reporters who have maybe not been trained in health or science, who have sort of been thrown at this topic with not a lot of training, and maybe with editors who don't know the subject matter well. And I feel for reporters in that position because you're sort of trying to figure out who is the expert and whose voice you really should trust, while simultaneously trying to put out a story that day. I think that's a terrible position to have a reporter put in. And then I think what ends up happening is convenience takes precedence, which is who's going to pick up the phone, who do you know is going to send you back an answer when you need to publish in an hour, and those voices tend to rise to the top. So I think it's something that as a journalist, I have to sort of consciously push against not taking the most convenient person.
It is challenging. And Ajay, you're usually or often on the receiving end of this, and I think probably more so during the pandemic than ever before. How do you decide, as somebody with expertise, whether you're the right person to work with a reporter, and what should other maybe scientists or experts ask themselves before they respond?
I make a conscious decision to reject requests to comment about certain topics, even though I could be a voice for that. I think they're better voices, and people who are, K through 12, for example, policies is something you won't hear much from me about. One, I don't have children, and so I always tell people I'm either exceptionally objective or people will consider me exceptionally naive, and so I prefer not to really delve into that topic when there are armies of pediatricians and parents and others who are deeply diving into that kind of information. When it comes to topics related to health disparities, I feel like I can comment somewhat on that, but there are experts on our campus who I would definitely make those referrals to. So Yeah, I would say I try to be responsive because I feel like it's part of my duty as a employee of the university to be as responsive as I can, but you can't accept every invitation to provide a perspective.
Can I jump on something Caroline was telling? When Caroline was saying, yes, she's lucky because she has the luxury of being able to go in depth. She has her list of sources and so on. So we talked a lot about the different type of media, but we didn't talk about the different type of readers or the different type of viewers. I mean, like maybe here in this room, we don't represent, the everyone that encounters science in their everyday life, and shouldn't make assumptions about how they would react to the information, who they would trust, and how they would interpret the data. And the reason I'm saying that, because there was a study that was published by one of my colleagues in my department, Nanli, that looked at the flatten the curve model. And then we just assumed this was a great way to communicate and so on. And she showed with her research that actually people reacted very differently. I didn't have really a good idea of what he meant. Like they couldn't really relate to it. It didn't make sense. So the notions of, like graph literacy or numeracy and so on came into play to explain how they would react to those things that for us look a logical way to display data for people who understand and so on. So I think we should be careful also to be just binary in our way of presenting what's right, what's wrong, what the way to do it, and so on. It really, really depends so much about the receiving end, as you were telling, Caroline, and how people on the ground are encountering the information.
It kind of reminds me of the experience of, we're all teachers.
Yeah.
So, you teach your calculus class, and then you see the test come back, and then it's like, well, it doesn't matter how clear I thought I was.
Exactly.
Like, I felt my explanation was perfect. Yeah, guess what? It wasn't, because I can see what comes back on the test. And, so yeah, we have to, you're absolutely right.
Every semester, they may be different also.
Every semester they're different, and every student is different, and it could be different on one test than another. So absolutely, like to be completely honest with you, my heart kind of sunk when you said that, because I love Flatten the Curve. I was going to be like, actually, like,
I'll send you that
the
study.
communication was great, because like, look at Flatten the Curve. What a great, brilliant, crisp, clear, but apparently not. But of course, I'm reacting as me looking at it. Okay, I'm chastened.
Can I react to that and ask a question maybe of Caroline or all of us? Sort of the extent to which feedback informs how we may cover a topic later. How well are reporters and scientists sort of modifying their style of communication or the way they report things? And where is that feedback coming from?
Well, first of all, like people are trained as science writers. I mean, they get to excellent schools. I mean, my department has a master in science writings. I mean, Caroline went to Columbia Journalism School and so on. So you have different type of training, obviously. But second of all, like the National Academy of Science has a standing committee on the science of science communication with a representation from different media organizations. We work with the National Association of Science Writers and so on, where they look at the social science aspect to inform how they might, cover different things, and particularly the literature on misinformation. And Caroline is aware of that. Like all that idea of how the headlines will actually really impact how people will process information has been, directly linked to different social science studies. They should do it more, but hopefully will continue in the future. But we have those collaborations.
Yeah, I think recognizing the human element of science and science communication is really important. But I think we have an online question, and then we have an in-person audience question.
We do have an online question about social media. So Rick is asking, when a chiropractor, for example, is spewing incorrect information and misinterpreting research on social media, is there any action that can be taken?
I mean, my perspective as a reporter is that you cannot fight wars with every single person on Twitter. Like, it's just not worth it. And in many cases, you might be amplifying a piece of misinformation by engaging with it. I don't think that there's hard and fast rules, or it's definitely not easy. What I think about more is if I start to see the same piece of misinformation circulated again and again and again, or the person who's circulating misinformation has a huge audience, I think that then heightens the urgency to respond and to address it. So I think there are levels. There are times where I'll choose to just like totally ignore something, and there's times where I will choose to engage, particularly if I can give people a source. So if somebody says something that's just, clearly factually inaccurate, and I can immediately just be like, well, the answer you're probably looking for is actually here, and I can link to it for you. I think people respond really well to that, even in the terrible medium of Twitter when you give them the primary sources. And to answer the question just now about feedback, for me, I have a number of different, I apologize for my cat walking by, guys.
We love cats.
This is how you know it's truly a hybrid event. There's now been a cat. So we hadn't
Sorry.
arrived.
We should get a wind cat who can walk around on Beluga during the.
I'm sorry about that. I have a variety of levels of feedback. I think one of the things that's important to me is that I have editors who are not health and science editors who read the story. So there are several layers of editing that happens before something goes out. And if, my direct editor has done a lot of healthcare stories, but she's not been primarily a healthcare reporter. So if she says to me, I don't understand what you're saying, I have to be like, my editor is one of the smartest people I know. If I am not getting across to her, it's not going to get across to anybody. So like that's sort of a primary level of feedback. And then if I do pay attention to social media and readers write me after my stories, and if a lot of them are making the same point, then I'm going to reconsider, like, how did sort of something I say come across in a way that it was interpreted this way and hopefully learned for the future. But, I always get one-off emails from people who are like, I'll write a story about X and they'll be like, well, you didn't talk about this other thing, and I'm like, that wasn't what the story was about, dude. Like, and so I think I just can't give that too much weight at that point.
Are you receptive to feedback from your sources or from other experts? And I think that was maybe one of the things that Ajay is curious about.
Yeah, I take the position that I don't think I am there to be a megaphone for any one person. And oftentimes, if I feel like a source is like, this is exactly how I would write it, and maybe gotten a little bit too close to that one source's perspective. So I definitely care about the feedback from my sources in terms of, I want to make sure it's accurate. I want to make sure that like the overall gist was correct as well. Again, like it's not enough to be accurate at every word level. The whole story and sort of the implication it carries across has to also be right. But I generally feel like if all of my sources are very slightly unhappy, that's also not a bad thing, because I've probably found a path that is as true as I can report, even when there are a lot of different voices that have different perspectives.
Yeah, thanks, Caroline. Dominique, did you want to comment briefly on the social media question, or should we get to our audience question?
No, we should turn to the audience
Okay.
questions.
Thank you for being patient.
Yeah, so your story is only ever going to be as accurate as the data that you're given. And I've always been amazed during this whole 2 years at how much data we were getting from remote areas of Wisconsin and so on. So do you ever ask questions about the data reporting, about the accuracy, about is there any way to watch the data coming in and know that it's actually valid? Is it accredited by some public health body? How does that actually work? Because it's a huge logistic problem.
I'll comment and say that there are a lot of inherent limitations in all sorts of data that are collected. If the limitations don't change much over time, we can rely maybe on relative changes in inherently biased data to maybe still salvage some information from what's being collected, and over time still try to improve how data is collected. Good example, in the very beginning, a lot of deaths were underreported, and now far fewer deaths are underreported that are due to COVID. But if somebody is going to look at any trends over time, you have to acknowledge that our data in the beginning didn't have as much high quality. But you're right, in some remote parts of the state or in the country, a lot of things are just not being collected as optimally as they should be. And that is a limitation, and that's something that people should be aware of.
So you have one source that you go to and rely upon, do you? No. Okay.
Not at all, of course.
Yeah, I think one of the things I was impressed by was the amount of data science and modeling and expertise that went into every single piece of data that we saw. It wasn't just one source, it was multiple sources. It was vetted, it was checked. And I think maybe to your point, Ajay, is maybe some of that over time kind of comes out in the wash. And that's where people like Caroline come in, right? If you start to sense that data just isn't passing snuff, right? That might be the basis for an investigative piece. I think we saw some headlines like that, for instance, out of Florida, where there was obviously some political motivation to suppress actual data. And in that case, there were whistleblowers. And so maybe to the extent that some of that does work out over time, but I think that's a really great question.
Question online.
We do have an online question. Anne is asking, can Caroline talk about her experience with journalists in other countries and anything she has learned from how they are dealing with the deluge of data?
So unfortunately, I'm not really in a position where I continually or sort of regularly work with journalists in other countries. So I, particularly for COVID, because our newsroom is US based. I think the challenges are similar in many countries for many reporters, just generally with the uncertainty that we've already talked about. I think that there are some countries that have the benefit of having more nationalized healthcare systems, which make the data a little bit neater. One of the issues I've run into a lot here in the States is that sometimes every state sort of has a slightly different method of reporting. And so one of my first questions is even like, can I use these side by side? Are these apples to apples? Is it fair to compare? And I think there's some countries in which that will be a lot simpler because the country's smaller or the systems were nationalized. But I think the challenges are more similar than different for the most part. Can we trust this data? If there's we've all been relying on international studies coming from everywhere for a lot of our science learnings and medical learnings. Ajay mentioned earlier, what happens when a study is not yet peer reviewed? And I think usually journalists have that added layer of security that, we're only going to report about something when it's already been published in a journal, which means it's been reviewed. That's all been taken away during the pandemic. And so similar to what Ajay said, like my kind of rule for myself is I never let a preprint walk alone. So that means if it's not been peer reviewed, I'm going to wait for there to be more studies that cover the same topic and see if there is consensus. And I think that every reporter globally is grappling with that.
So I can comment on that because I've been quoted internationally. I also have some colleagues that, particularly I've been working with Japan. I'm part of a social network of social scientists that have been releasing reports for the National Academy of Science. And they've been translated in different languages. So that's why I've been quoted, not because. And particularly in Japan, what's interesting is the journalists don't ask you the same questions. And the reason they don't, and actually I have some students in my class that had a guest speaker from Japan that's like the right hand of the Fauci of Japan, and explained to us that culturally Japanese people like the numbers much more than Americans, and they like to actually play with numbers. They like to have a dashboard where they can visualize the numbers in a way that we don't even think our students can do. So it was really eye-opening to see that actually audiences in Japan do not react to numbers the same way that we do. They're trained very different and so on. And journalists approach the stories extremely differently. So I don't know if that answered the question of your audience, but I thought that was super interesting.
Can I ask, it raises a question actually, who designs our dashboard? Kelly, do you know?
Here at the university?
Yeah, like sort of someone inside the university decided how our data would be presented. Who does it? Do we know?
Yeah, it's a team of web designers. So the people who create all the websites for the university, it's people like Ajay weighing in. It's we've had data scientists also part of that process, thinking about what information is most important and how are people going to most easily consume that information. And we also look to what the state was presenting, what Public Health Madison and Dane County were presenting in order to maintain some consistency between the data streams that people in Wisconsin in particular were interested in.
We do have a couple more online questions for Caroline. Yeah, thank you. Do you think that it is inevitable that misinformation will spread about science due to people's education levels, morals, and political views? Is there anything that must be done structurally to correct that belief, the belief and spread of misinformation?
Oh, I'd love to hear the other panelists' response to this question as well. I don't think it's inevitable. I do think that it's, this is one of those questions where I feel like there is no one generalized answer. I think the answer is, it depends on who the person is, what their community is, where they primarily get their information from, and where their own biases are when they're coming to this in the first place. And I do think that the one thing I would say is I do think that people tend to sort of self-reinforce once they have a belief. So if somebody, has come to the, belief that, a certain source or a certain type of scientist is not credible, I feel like they're going to tend to like find more evidence to back that up. But I think it's too hard to say that this is sort of inevitable in a general sense. I hate predicting the future, can you tell? Structurally, though, I'll just speak for journalism. I think that my hope would be actually that we slow down a little bit. And I think sometimes the haste can lead to either, as I've suggested, some slightly less thoughtful headlines, or writing about a single preprint, and then later on, new information comes out and people who read the first story may not be reading the follow-up story. And so just thinking about like, when is it right sometimes, even in an urgent pandemic where people really want and need information, is it right sometimes to just wait a little bit? That would be from the journalism side.
Anyone else? She did say she wanted to hear from you.
I'll just say that misinformation and disinformation has been around for a long time. And I think it's obviously been amplified during the pandemic, and it gets amplified because of social media, but it's no problem. And so in some ways, I do think there's an inevitability for this simply because it's been around for so long.
But I would say, here's what I'm going to do exactly what we're not supposed to do and like talk outside our lane of expertise.
I do that a lot.
But it's absolutely true that, right, like before there was social media, people were still like fluoride in the water will make you a communist, or like whatever, like that existed. But it is the case now that there are like pretty large companies whose business model depends, not ProPublica, right, not the Washington Post, but like whose business model depends on like what will make somebody click and share, like what's sticky. This incredible, in a value neutral way, efficiency of transmission of words and thoughts and ideas. And it's very clear, right? It's stuff that makes people angry and stuff that makes people incensed, gets more engagement, is spread more easily. And so those places do have a real financial incentive to sort of keep that flow going, not because they're evil, but because that's how business works. So I do think it's at least plausible that there's something structural in the current information environment that is absolutely encouraging, in the same way that sort of like, 19th century London was like encouraging of people getting cholera, like not because they decided that people should have cholera, but because this like incredible density, which was really good for some things, was also sort of not as a piece of design, really good for transmitting disease. Is that a ridiculous metaphor to an epidemiologist? Maybe it is.
That's good.
Okay.
Actually, I would agree with both of you. I mean, as Ajay said, going back to 19th century, like Great Britain, you had protests against the vaccines, and they were actually pretty powerful. It was so anti-vaccination protests have been going on and on. But as you say, social media platform allow those people to find, a community that's just beyond their neighborhood, right? And I think like those platforms, they do need to be made accountable. We as social scientists ask for actually having transparency in their algorithms. We know we want to understand how they function, and we know, as you said, that like right now, like Facebook, will place issues on your timeline if they generate engagement, and what makes people angry and so on generates engagement, hence he's like going to your timeline. But to your point, Caroline, it's true confirmation bias. We need to actually like information that confirm our views, and we tend to discard information that doesn't confirm our views. But going back and circling to what Ajay was saying, I was saying, no, you cannot expect people to be scientists, but it does work to tell people, you know what, sometimes you need to be aware why you're doing this, and you may actually be angry and sharing because you're angry, but why don't you relax and pause? And people say, oh, you're right, I don't really think about sharing. So it does actually work to make people aware of potentially biased information and make them react. It doesn't mean it works for everyone, but if it works for enough people, we may slow things down, as Caroline was saying, and this is a good thing.
Yeah, and I think we tend to think of other people as the ones
Right.
doing
Third
the
person effect.
misinformation spreading,
Yeah,
and yet
everybody share Caroline's stories, share ProPublica, which is amazing, which is amazing things. If you're not already reading it, I donate it to it every year because it's an amazing publication. Don't share
really
about
good,
Nicki
yeah.
Minaj talking about testicles. Like share Caroline's stories instead. That's my ask.
yes, and I think everybody could benefit from taking a step back before you
Okay.
instant gratification hit that
Exactly.
share. This is why Twitter's such a cesspool sometimes, is everybody's just kind of shouting into the void.
Yeah.
We have time, I think, for 2 more questions, and I know we have an in-person audience question, so I want to go to you.
I first of all wanted to thank the panelists for coming, and my question relates to the title of the talk tonight, The Deluge of Data. And I'm trying to imagine that here in the 21st century, the amount of data that has been collected, and I wonder if how that's going to get used in the future,
That's
and
true.
in what ways that will be used to prevent future pandemics. And if you could just comment on that, I appreciate it.
The 2 meanings of the word prevent are very relevant to how we answer that question.
I'm just going to say one thing. I think we need to be wary. I think I actually raise a lot of concern about privacy-related issue related to private data and so on. And so I think we haven't talked about this, like how data is obtained and how much information may be actually accessible because of that. To tell you the truth, I never got a cell phone to have the green badger thing at UW-Madison because I don't want UW-Madison to potentially have my data. So they gave me a special cell phone just to have it. So like that's tell you how much careful I am with data. So this is my take. I think privacy and data and how it could be used is a big concern.
I won't comment about the privacy, but I'll say that had we had more data, specifically scientific data to surveillance data for novel pathogens in hotspots around the world, we might have been able to detect this virus before there were human cases, potentially, right? And I think I'm not going to devalue data, but I think there's higher quality and lower quality data, and I think we certainly are in this era where just more is better, and that's unfortunate because that does contribute ultimately to the confusion of what data to use and what not to use when we want to move forward and prevent the next pandemic.
I'll just add that I think that's a fantastic question. So thank you for asking it. I think my answer would be partly that I think we are very good at like refighting the last battle. So like to some degree, I think if we have another pandemic come up, it's going to be like, we'll be ready with the masks this time, but so a lot of the data we've generated is specific to this particular coronavirus. And I think at that level is not where I want people to engage with it. Like the level I would love people to engage with it is kind of a little bit what Ajay suggested, which is what were we able to learn? What should we have been able to learn sooner? Where were the gaps in our data early on, and also the gaps that took a really long time to be filled? And what does that say about the systems we have that we need to change for the next time? Because we're not supposed to re-prepare for the same coronavirus next time. I think we have to think at a sort of a higher level, like how do we change surveillance so it would be, so we're better prepared to catch any sort of bug that comes up next time? How do we have our hospital system better ready so that, whatever comes at them, they're not going to have the similar sort of strain? And I think that is looking at the data in perhaps a sort of more holistic way. And I'm not sure who's going to do that, but I really hope that is done.
Where CDC just created a center of surveillance, with wastewater surveillance and so on. We've been involved a little bit with that. So like they are trying to learn and like actually do prepare for the future. Well, it's still nascent, but I think they can build on what was learned during this pandemic to do better in the future.
And I'll just, the last infectious agent that got everyone's attention before SARS-CoV-2 was Zika virus, which is transmitted through mosquitoes.
Yeah.
And the one before that I think was pretty significant pandemic was HIV, which is sexually transmitted and transmitted through blood products. So who knows what the next one's going to be and whether we'll truly be able to apply what we're learning to the next pandemic. We'll always have some more to learn, I think.
This is one of the things I love about science, though, is we are collecting so much data, and it is impossible to know all of the ways that could be used in the future. I just think about, what the textbooks are going to say and the research that follows from this time in our history for the next decade or two or longer. So all of these things aside, I'll say there are some queries, surveillance projects that are controversial, looking for potential mutations that could lead to pathogenic research or pathogenic viruses. That's kind of a subject of debate right now with the SARS-CoV-2 virus. But yeah, I think there's probably a lot that we don't know that we're going to know.
RNA vaccines you can trace it back to 1989 studies done on this campus, right? So
Yeah,
you
Professor
never
John
know what
Wolfe.
the future, what's going to be in the future. You're right.
We do have another online question, and probably is going to be the last question from Larry, who talks about early in the pandemic, modeling was the big story. At the same time, the results seemed way off in the early days of the pandemic. There's been a lot less talk about modeling recently. Why were there so many problems with modeling early on?
Maybe I'll take that one because that's sort of the mathiest question we're going to get. But I think it speaks to what Ajay said. I think that I actually don't think the modeling was so bad given what we knew at the time. And when people say, because there were sort of, especially at the beginning, there were different models that gave radically different outlooks. Of course, you can find one that was wrong, but I mean, it reflected the truth of the matter, which was that there was just so many parameters that we didn't know that for any like long-term prediction, they were not going to be so useful. Now, of course, all math people sat and argued about this a lot in like March and April of 2020. So there's certainly like particular methodological quibbles I could make with like certain high-profile modeling people. But on the whole, I think it was not so bad, especially in the short term, especially for short-term prediction. And I think it would have been unreasonable, even though people wanted it, I think it would have been unreasonable to say like, it's March 15th, 2020, tell me the whole story. Tell me how this is going to go and how it's going to end. I mean, and most people were pretty honest about the fact that that could not be done at that time.
Yeah.
I'll just maybe quickly comment that as we were learning about the transmission dynamics of the virus, the modeling improved. And I think the one thing that probably improved the models the most was just a recognition that there's so much spread by asymptomatic people. And that wasn't something that was easily measured in the beginning. And a lot of modelers were falling back on the dynamics of SARS-1, first SARS, and the MERS transmission, which don't transmit asymptomatically nearly as much as SARS-CoV-2. So the models may have a lot of uncertainty associated with them in the beginning simply because the inputs may be wrong or have some assumptions, but over time they do improve. And I think they do pretty well now.
Yeah, I'm no data scientist, but I had the privilege of working with many on this campus early on in the pandemic. And maybe this is a terrible analogy, but I think about it the same way that I think about meteorology, in that the science behind the weather is actually really refined and really specific. And meteorologists don't rely on one source of data, right, to come up with a forecast. They're usually using many sources, many models to come up with sort of the best estimate informed by the science. And I feel like we saw a lot of that happening in real time. But to your point, Jordan, we want to be told it's going to rain exactly at this time, on this day. And yet that's just not the way the natural world works.
But the difference is that if everybody thinks it's going to rain and everybody carries their umbrella, that doesn't make it not rain. So, I mean, I think the other thing is that inevitably, when you're trying to model the course of this pandemic, human beings respond in the aggregate in highly unpredictable ways to changes in conditions.
That's
and
exactly it.
I promise you, nobody was even trying to model that. But of course, if we're honest, everybody knew that was going to affect how things went. So what can you do except say like, well, we can model disease transmission, and if behavior sort of is something like this, then this is what will happen. But there's this kind of complex dynamical system where conditions affect human behavior affects conditions, there's feedback, and that curve cannot be flattened.
Yeah.
This is why we need people like Caroline. So please, everybody give a round of applause to Caroline, our science journalist in residence, and our panel here. Thank you, everybody.
Well, thanks for having us.
Yeah. And I don't want to speak for the panelists, but if anybody has questions they want to stick around to ask.
Caroline, you're going to come here for real at some point, right?
I would love to.
Okay.
Don't worry, I'm looking for an excuse to bring our virtual science journalists back or to Madison, those who couldn't come during the pandemic.
Thank you so much, everybody.
Thanks, Caroline.
Right if we're on our.